This is Dr. Rula Al-Hamid, a gynecologist and obstetrician at Dr. Najib Layous Center. And I'm going to talk about pregnancy month by month. What to expect during months of pregnancy. First month of pregnancy. 1 week pregnancy. You may not feel that you are pregnant. The fertilized ovum will produce a zygote which will divide as it's moving down to the uterus, where implantation occurs often 6 days after fertilization. At this time, the zygote will form the blastocyst reaching 0.1 to 0.2 mm in diameter. You won't have nausea nor vomiting, but you may notice increase your basal body temperature beyond day 16 post-ovulation. 2 week pregnancy. You may see some vaginal spotting as the zygotic implants into the uterine wall. The mother will start to feel more tired, her breast will become engorged, and may experience frequent urination. At this time, your body will start to produce beta-HCG, which will induce estrogen and progesterone production. Try to avoid alcohol, caffeine, tobacco, stress, and try to get enough sleep. Have appointment with your doctor to confirm pregnancy. Third week of pregnancy. By ultrasound, you will see intrauterine sac. Your belly will be the same size as pre-pregnancy, but you may experience some fatigue, breast engorgement, frequent urination, which will fade up by time, so don't be worried. Your diet should have increased calcium content because your baby is using calcium for his growing bones, and you need to start on folic acid. If you had lactose intolerance, or you are vegetarian, or had twins, you need to take prenatal vitamins. 4 weeks pregnancy. During this week, your symptoms will increase. So you will start to complain of more morning sickness because your body will produce more estrogen and progesterone, which will affect your gastrointestinal tract by decreasing its motility, and gastric emptying is also prolonged. If you visit your doctor by this time, you will be weighed and your obstetric and medical history will be taken. Blood test is ordered. CBC, random blood sugar, urine analysis. You should start folic acid, and the nutritional and lifestyle advice is given for you. Second month pregnancy. Weeks 5 to 8. 5 weeks pregnancy. By this week, your fetus is 4 to 6 mm long, and major organs start to develop: brain, heart, kidney, and liver. You will feel the same symptoms as before, but you may notice that your areolas are darker in color, more red. Your breast is firmer. You may also feel tingling sensation. If you have a cat, let somebody else to care about it. Give special care to hygiene. Wash your fruit and vegetables very well. Cook your meat very well. And wear gloves if you want to care about your garden to avoid contact with toxoplasma, which will affect your baby. Six weeks pregnancy. The size of your baby is 8 mm and is growing rapidly, and he is moving his limbs by the end of this week. By the end of this week, your morning sickness will be more obvious. So take care of your diet. Avoid fatty food. Drink a lot of water. Eat small frequent meals all through the day. And don't forget your vitamins and vitamin D. Exercise 15 minutes a day. Consult your doctor before taking any drugs. Avoid ibuprofen. If you have vaginal spotting, inform your doctor because it may be a sign of miscarriage. Seven weeks pregnancy. Your baby is 13 mm long and his brain is growing rapidly. He is moving although you may not feel it. By this week, his genitalia is formed, but it's not recognizable on ultrasound until 16 weeks, although the sex of your baby is determined since fertilization. Why you have to urinate more? Because HCG is increased, and it affects the blood flow to the kidney. Your kidneys are more efficient, and they clear waste more. Also, your uterus is compressing your urinary bladder. You will be more moody, because your hormones are taking all over the place. 8 weeks pregnancy. Your baby is now 18 mm in length. He is growing at a rate of 1 mm per day. His limbs are more obvious and ossification of his bone is started. His eyelids start to form, but they still fused and won't be opened till 26 weeks. He will look like a human by this time, although his head is longer than his body. You may experience more fatigue, tender breast, abdominal cramps. Your moodiness is decreased because the placenta is taking the responsibility of continuation of your pregnancy. You may notice some bulge in your tummy. 9 weeks pregnancy. Your baby now is called a fetus. His facial features is more obvious. His iris is formed, but his eyelids still fused till 26 weeks. His digestive system starts to form, and also his diaphragm, which allow him to breathe and hiccup. You may experience more headache and migraine during pregnancy due to hormonal changes. Your breast may be enlarged, and its veins are more visible. Your nipples are darkened, so you may need to increase your bra size in order to fit your breast. You may crave for junk food, so avoid toxic materials. You may gain 1 to 2 IB per week, but don't be worried. Keep on eating healthy food. Exercise right. Drink enough water and vitamin C rich fluid. Avoid sugary fluid. If you notice spotting any time during pregnancy, consult your doctor because it may be a sign of miscarriage or ectopic pregnancy. 10 weeks pregnancy. Your baby is 33 mm in length, and he will double in size in the next 3 weeks. His vital organs start to function. The placenta starts to grow and supply the baby's need. You may start to feel some cramps in the abdomen due to stretching ligaments in your pelvis, which are relieved by mild analgesia and rest. You may suffer from bleeding gums because your progesterone makes the gum swollen and fragile, so care about your dental hygiene. 11 weeks pregnancy. Your baby is 35 mm in length. His head and body are equal in size. He can kick, stretch, and clench his fist, although you may not feel him. His intestine will move back to his abdomen by this week. Your pregnancy symptoms will subside, but don't worry. You will have more energy, but you may start to have constipation and heartburn. Your baby will start to react with you, so try to relax. Listen to happy, relaxing music. Think with happy thoughts. 12 weeks pregnancy. Your baby is 6 cm in length. He is now breathing using the amniotic fluid. Now you can feel your uterus above the level of pubic bone. You may experience heartburn because of your progesterone, which relaxes the gastroesophageal valve, and by this gastric juice will regurge back to the esophagus. So try to eat smaller meals and avoid spicy food. By this week, you should have your first fetal anomaly scan by doing the knuckle translucency scan to rule out trisomies. If it was abnormal, you will be advised to undergo further testing. 4th month pregnancy, weeks 14 to 17. 14 weeks pregnancy. Your baby is 9 cm long and 1.5 ounces in weight. The lanugo starts to grow to provide extra warmth. Kidneys start to produce urine, and the bladder will be filled and emptied every half an hour. And though urine will not be concentrated due to inability of the kidney to reabsorb water. The pancreas starts to develop and produce hormones. Your belly will be pushed up. Your nasal passage will be swollen, so you may notice snoring. Your blood volume increase, and your blood vessels may become fragile, and you may notice minimum nose bleeding. But if it becomes regular and heavy, you should inform your doctor. You may notice that your breast veins become dilated, your areolas more darkened and growing in diameter. You need to concentrate on protein in your diet in order to provide your baby with amino acids, which are needed to build up muscles and organs. You can find these in meat, cheese, milk, seeds, and nuts. "15 weeks pregnancy. The child now breathes in this fluid in order to help in developing the air sacs of his lungs. The ears develop, and the child can hear you, so you can talk to your baby. Now you may know the sex of your baby depending on the position. Your pregnancy symptoms may disappear by this week, so don't be worried. Your weight may increase by 5 pounds. There may be a line in the middle of your belly, which is called linea nigra, which will fade after delivery. Enjoy this trimester, because you will feel more energetic and fatigue will return again in the 3rd trimester. Omega-3 is good for your baby's development and its IQ. You can find this in fish, walnuts, omega-3 enhanced egg. You can exercise safely, but avoid horse riding, mountain biking, and skiing. 16 weeks pregnancy. Your baby is 12 cm length and 100 grams in weight. You may feel tiny movements of your baby. The baby may grasp the umbilical cord with the newly formed hands. If the placenta is located near the anterior, it may act as a cushion, and you may not feel these movements, so don't be worried. Your uterus now is located halfway between pubic bone and umbilicus. Try to limit the use of saunas and tanning beds because they increase your temperature and can harm the developing fetus. "17 weeks pregnancy. Your baby is now 13 to 14 cm in length and is growing rapidly. Brown fat starts to accumulate, and it has an important role in heat regulation. When traveling in a car, keep the lower strap of the seat belt below your belly. Your eyes may feel dry, so try to use eye drops. Avoid wearing contact lenses for long periods. You may experience constipation due to the effect of progesterone, which will slow down your bowel movements. It's time to start pelvic floor exercises. Hydrate well, exercise gently in order to relieve stress. Fifth month pregnancy. Weeks 18 to 21. 18 weeks pregnancy. The baby is moving all around your uterus, and you may feel those movements. The genitalia are obvious by this week. You can ask for a fetal anomaly scan to check that everything is okay with your baby. You may experience an increase in your appetite, so be careful about what you eat. The target weight gain for the second trimester is no more than 5.5 to 9 kg. Don't stand up quickly because you may feel dizzy as your blood pressure will be lowered. The best position for sleep is at your side because if you lie on your back, your uterus may press on your major blood vessels and restrict venous return to the heart. So put a pillow behind you or under one leg between legs. "19 weeks pregnancy. Your baby is 17 to 18 centimeters long and 250 grams in weight. The hair is now growing on the scalp. You may feel breathlessness, but don't worry. You may notice blurring of vision, which is due to water retention. It usually disappears after birth, and exercise will help in getting rid of it. You may experience a few stabbing pains in your sides, which are caused by stretching ligaments that support your uterus. But if these pains become more persistent or severe, consult your doctor. Skin changes occur due to extra estrogen. You may notice red palms and chloasma. Nipples are darker. "20 weeks pregnancy. Your uterus now is at the level of your umbilicus. Try to eat iron-rich foods like red meat, leafy vegetables, and soya products because it's necessary for red blood cell formation. Avoid using cleaning products because it may contain harmful chemicals. Your baby is 19 to 20 centimeters long and 310 grams in weight. Your baby is busy in meconium formation, which is a harmless mixture of amniotic fluid, digestive secretions, and dead skin cells. All of these accumulate in the baby's bowel and is excreted in the first nappy. 21 weeks pregnancy. Your baby is 21 to 22 centimeters long and 360 grams in weight. You may notice acne is increased because oil production is increased in pregnancy. So use oil-free makeup and avoid acne medication. You can book to have antenatal massage to relieve stress. You may remain awake all through the night because of your moving baby. You may experience varicose veins, swollen ankles, and so exercise regularly and elevate your legs and feet and wear maternity stocking, which will relieve you. 6-month pregnancy, weeks 22-26. 22 weeks pregnancy. Your baby face is more obvious and his lips are well formed. You may experience stretch marks on your abdomen, so try to keep your skin well moisturized during pregnancy. You may be forgetful. Try to buy your baby's equipment like buggies, car seats. Consider thinking about your baby's name. 23 weeks pregnancy. Your baby will double in its weight during the next month because of fat deposition under the skin and muscle development. Your baby is quite active. You may experience more vaginal discharge. You may be more emotional, so don't worry. Your ankles and feet swell up, so drink a lot of water and elevate your legs. Avoid standing or sitting for long periods, and be careful. This may be a sign of preeclampsia, especially if there is facial swelling or eye puffiness. 24 weeks pregnancy. Now your baby is 30 centimeters long and 600 grams in weight and is gaining 90 grams per week and will start to fill up. Your belly looks like a football. You may have hot flushes and sweating. This is because more blood is pumped around your baby. You can do your fetal anomaly scan 4D during this week. You need to do a glucose screening test if you are at high risk to develop diabetes. In order to avoid pregnancy complications, difficult delivery, and large-sized baby. Pies become itchy and painful, so drink a lot of water and eat a high-fiber diet. "25 weeks pregnancy. Now your baby is 34 cm and weight is 690 grams. Your husband can hear your baby's heartbeat when he presses his ear against your belly. Your hair may look thicker, shiny because of pregnancy hormones, but unfortunately, this will shed off after birth. Exercise regularly and drink plenty of water, but don't exercise if you feel dizzy or have shortness of breath. Check your hemoglobin level, and if you are anemic, check ferritin level. 26 weeks pregnancy. You may feel that your baby is responding to loud voices by jumping. Eat well, get a lot of rest. Your blood pressure may increase slightly, but it's still lower than pre-pregnancy. Be aware that you don't have preeclampsia, and these are its symptoms: photophobia, pain at the upper abdomen, vomiting, increased blood pressure. 7th month pregnancy. 27 weeks pregnancy. Your baby is now 36.5 centimeter long and around 875 grams in weight. Your baby opens his eyelids. Your baby's lungs are immature, but they can function with the help of mechanical ventilator if delivered at this time. You need to think about what sort of birth you would like, such as at home, submerged water, or hospital birth. Think about the type of pain relief you need during labor. You have to inform your doctor beforehand. You may have more and more muscle cramps because of your enlarging uterus, which compress on veins and nerves of your legs. To reduce the cramps, you need to exercise daily. You may experience symphysis pubis dysfunction, which may cause you pain while walking upstairs. "28 weeks pregnancy. Your baby is 1 kilogram in weight, 37.5 in length. Antibodies are transferred from your blood to your baby in order to boost the immune system. If your screening test for diabetes was positive, you may be offered a glucose intolerance test. If you have a negative blood group and your husband has a positive blood group, you may be offered the first dose of anti-D. You need to do stretching exercises and massage your legs. Cut out caffeine consumption in order to get rid of restless leg syndrome. You may increase in weight on average 5.5 kg in the last one-third of pregnancy. You need to visit your doctor every 2 weeks. You may have an increase in vaginal secretion, so don't worry, but visit your doctor if it becomes offensive or itchy. If you feel any breast lump, don't ignore it. Visit your doctor to check it immediately. "29 weeks pregnancy. Your baby is 38.5 centimeter in length. His weight 1.1 kilogram. You may feel more movements some days more than others, because your baby is like you, more energetic at certain times. You may experience hemorrhoids. If they become painful, do a sitz bath, but don't take any medication before consulting your doctor. Don't lie flat on your back, as this may make you feel dizzy. Avoid wearing contact lenses, as your eyes may become dry. Stretching exercises will help you in relieving stress. You need to eat a high-protein diet, full of vitamins, folic acid, iron and calcium. Calcium is found in milk, cheese, yogurt, and orange juice. You may experience heartburn and constipation. Stay with a high-fiber diet and include plenty of water. (30 weeks pregnancy). Your baby is 40 cm in length, 1.4 kg in weight. You may feel tired by this time of pregnancy. Also, your ligaments may be more loose, causing your feet to spread. You may need to buy new, more comfortable shoes. Don't worry, you will return to your normal size shortly after birth. Your mood swings may reappear again, so try to take a warm bath and drink milk before bedtime to make you feel more relaxed, comfortable. You may experience Braxton Hicks contractions. 8th-month pregnancy, week 31 to 35. 31 weeks pregnancy. Your baby is 42 cm in length, 1.6 kg in weight. Fetal movement may awake you at night. Kick chart can be used to monitor your fetal movement. You may experience heartburn. It's safe to have sex during this stage of pregnancy. 32 weeks pregnancy. Your baby is 1.8 kg weight, 43 cm in length. You may gain weight 1 pound per week, and half of this extra weight is from fetus growth. You may experience heartburn as your uterus is compressing your stomach. Try to eat small, frequent meals. When sleeping, try to elevate your head on a pillow. Back pain may increase as pregnancy advances. But if you didn't experience it before, consult your doctor immediately. It may be a sign of labor. 33 weeks pregnancy. Your baby is 2 kg now and 44 cm in length. Your antibodies are traveling to your baby's immune system to help in fighting germs after birth. You need to consume more calcium in your diet in order to help your baby's skeleton to harden. You may face a problem to find a comfortable, appropriate position for you to sit or to sleep. You may experience aches and numbness in your hands and wrists. Try to splint your wrist or take frequent breaks away from your work in order to flex your fingers and exercise your wrist. As skin stretches more, it may become more itchy. You can use a moisturizer, but after consulting your doctor, as it may be a sign of obstetric cholestasis. If your baby's face is not yet directed downward, try to spend some time on your hands and knees and wiggle your hips and arch your back. Fourth month pregnancy, weeks 14 to 17. 14 weeks pregnancy. Your baby is 9 cm long and 1.5 ounces in weight. The lanugo starts to grow to provide extra warmth. Kidneys start to produce urine, and the bladder will be filled and emptied every half an hour, and though urine will not be concentrated due to inability of the kidney to reabsorb water. The pancreas starts to develop and produce hormones. Your belly will be pushed up. Your 35 weeks pregnancy. You may have frequent urination or experience heartburn because of the enlarged uterus. You may experience Braxton Hicks contractions as abdominal cramps. You may have an increase in vaginal discharge, which may be accompanied with blood. This is called the show. Your baby is 47 cm in length and 2.7 kg in weight. It's safe to drive a car, but put the seat belt beneath your pump. If you are thinking of returning to your job, you should think about childcare. By this week, you should determine your birth plan and discuss it with your partner. 9th month pregnancy. 36 weeks pregnancy. Your baby is 2.75 kg in weight and 48 cm in length. Movements may slow down, but you should expect about 10 movements per day. If you don't, then drink a sweet drink and or lie on your left side. After 36 weeks, the baby will be regarded full term. If your baby is presenting by the bottom, your doctor may try to do an external cephalic version in order to push your baby's buttocks upward under ultrasound guidance. You may have an antenatal visit once per week. If you notice any vaginal bleeding, constant abdominal pain, persistent or severe headache or blurred vision, you should go to the hospital immediately. 37 weeks pregnancy. Your baby is 50 cm in length and weighs about 3 kg. Antibodies will continue to transfer to your baby's body, and then they will be transferred through your breast milk. You may feel uncomfortable while walking. Braxton Hicks contractions or false contractions may be more frequent this week. You may experience diarrhea in preparation for labor. Don't be worried if your umbilicus is protruding, as this will disappear a few months after delivery. 38 weeks pregnancy. Your baby is 3.4 kg and 51 cm in length. If you feel tired, take a nap, catch up on reading, and spend more time with your partner. Watch your feet and ankles for swelling and elevate your legs. Contractions may be more painful, but true contractions start at the top of the uterus and spread downward through your back into the pelvis. They will be stronger and painful, and will not be relieved even when you change position. "39 weeks pregnancy. Your baby is 3.45 kg in weight and 52 cm in length. When your baby is ready to be born, a chemical message is sent to the placenta, and this will increase estrogen production, which will lead to labor. Most doctors will induce labor after 41 weeks. You may have leaking water before contractions begin. If this happens, labor needs to be induced. Look for bloody show, mucus blood passage, nausea, contraction, breaking water, which may be in the form of gush or small slow leak. All or any of these could be a sign of labor. If you pass your due date, you need to do a fetal test to ensure that it's safe to continue pregnancy, or if it's necessary to induce labor. 40 weeks pregnancy. Babies differ in their weight when they are born, but most of them will be 45 to 55 cm in length. Don't be stressed out because of these extra few days. Enjoy spending more time with your partner. You may be anxious about when your water will break or when labor will start. Try to relax and always make a plan for everything.